102.9 WDRC FM. This is Jerry Kristafer. It's Saturday morning on the Big D. Well, we've already experienced our first snow of the season. It's not even winter yet. And for many of us, it was that wet, heavy snow which brings to mind shoveling and possible heart attacks. And joining me on the phone this morning is Dr. Kevin Gentile from the Emergency Medicine Department at Bristol Hospital. How are you, doctor?
I'm doing great. Thanks a lot for having me on today.
Now, a doctor like yourself, obviously, when it snows, you know what to do. You know better than most of us what not to do, right?
Yes, unfortunately, I'm all too experienced with the snow and how to handle it. I think a lot of people end up getting into problems with the snow because they don't they kind of look at it as a chore and they don't realize that really it is a pretty good workout. When you do it, you put a great deal of stress on your muscles, especially your back, but also you really put quite a bit of stress on your heart and your cardiovascular system. And, if you don't respect it and appreciate it as really an exercise, you can definitely get yourself into problems.
And as they say, you don't use your back, you use your knees. But for those of us, and I admittedly don't exercise, I know I should, but it is an arduous workout to say the least. But for those of us couch potatoes that do nothing, I would suspect it's even worse for us to then jump out and try to shovel snow as though we were in shape.
Yeah, absolutely. Yeah, I mean, it's unbelievable when you actually look at the stats of when you're shoveling snow, exactly how strenuous it is. Within 10 minutes of shoveling snow, the average person will move about 2,000 pounds of snow. So when you think about that and the strain it's putting on your body, it's unbelievable. And I mean, on your heart, the average person within 2 minutes will at least double their heart rate. The average person increases the heart rate within 2 minutes up to 175. So you can just imagine the amount of stress that's putting on your body. It affects all of us, even if you think you're in good shape. The stress that you're undergoing when you're shoveling puts us all at risk. So you just have to, constantly be evaluating yourself when you're doing it. And if you, start experiencing a chest pain, weakness, lightheadedness, or shortness of breath, you have to stop immediately and seek medical attention.
Right. So if you're having these symptoms, do you call 911? Do you call the hospital? What exactly do you do? What's the first step?
Yeah, the first step would be to stop doing what you're doing immediately. Okay. Rest, and then the second step would be to call 911 and seek their guidance.
We're talking with Dr. Kevin Gentile from the Emergency Medicine Department at Bristol Hospital. But there are other things that happen in the wintertime associated with the snow that can cause injuries.
Yeah, absolutely. I mean, with the snow, we always have to worry about when we're driving. It's very common sense, especially in New England, but it's things that we all forget to do every year. You just have to give yourself more time to stop. It's better to give yourself a few extra minutes so you're not rushing. You always have to be careful. It's going to be slippery out there, so that's a problem not only in cars, but when you're walking around.
And snowblowers, have to worry about those?
Yeah, those can save you a great deal of stress when it comes to shoveling. I mean, I think we all know the dangers of shoveling now. But snowblowers present their own problems. If one gets clogged, the last thing in the world that you want to do is put your hand in there. You want to have a stick to try to clear it, but by all means, please do not put your hand in the snowblower.
Right. Exercise caution.
Absolutely.
And unfortunately, doctor, I tell people that's the only exercise I get is exercising caution. But I'm working on it.
Absolutely. It's a start.
Dr. Kevin Gentile from the Emergency Medicine Department at Bristol Hospital. Thanks for your time here this morning.
Oh, thanks a lot for having me.
All right, take care.